You're listening to Don't Tell Me to Relax, the award-winning, no-nonsense, always friendly, down-to-earth fertility podcast. I'm Hannah, a fertility acupuncturist and big believer that fertility care and education should be better. Each week, I sit down with a guest to share real stories, advice, and honest conversations to help you feel better informed. And for care and connection, we have our Don't Tell Me to Relax online fertility community and our clinics in London and across the UK. To find out more about getting involved and working with us, the details are in the show notes. Don't Tell Me to Relax is proudly sponsored by the lovely people at Acupips. Acupips is the original ear seed company founded by acupuncturist Zoe Young. Ear seeds are tiny seeds or metal beads attached to an adhesive and placed on pressure points in the ear. They're brilliant for calming the mind, easing anxiety, and restoring balance. We use them in our clinics all the time. Head to acupips.com to find out more and use the code RELAX for 20% off. It is lovely to have you with us today. Today, we are going to be talking about the topic of egg freezing because it feels like over the last few years, there has been a real explosion in people talking about egg freezing, celebrities freezing their eggs and documenting it on social media, and lots of people telling us that egg freezing is the way that a woman can preserve her fertility. So, we are going to just unpick that a little bit and talk about the process, and who better to talk about this topic than our very own Marca, who is not only an embryologist, but she is an acupuncturist as well. So, Marca spends much of her time looking at eggs and sperm and helping people prepare for IVF cycles, for natural fertility, or for egg freezing in acupuncture clinics. So she has got a wealth of experience and knowledge to share with us. So Marca, welcome back and thanks for coming on the show again.
Hi, hello, Hannah. Thank you for having me again. I'm so happy to be here. And quite happy to share about all this about egg freezing. So, yeah.
Would you like, before we kick off, do you want to just explain a little bit about what you do in both from both an acupuncture point of view and a embryology point of view?
Um, yes. So, my job as an embryologist, it is taking care basically of eggs, sperm, and putting them all together, making embryos, looking after them, and give all the good and bad news to patients. When working as acupuncturist, I feel closer to patients. I work with them, but in a different way. But by doing the acupuncture and listen to all these patients and all the stories that they have, I feel more compassionate about them, and I bring this compassion and care more into the lab when I speak to them.
So Marca, tell us, what actually is egg freezing? So what actually happens in the process?
Well, basically, egg freezing it is a method to preserve woman fertility. The beginning started, or all this started by helping patients that they have medical conditions. They were under treatment that affect their fertility. So then it was the beginning of all of this. Then what happened is like nowadays it's become a great option to preserve a woman's fertility and decide later when is your right time to plan your family, basically. And by freezing and storing these eggs, you can increase your chances to conceive in future. But it's also very important to say that it doesn't guarantee a pregnancy.
I hadn't really appreciated that egg freezing started out for people, for example, if you've got a cancer diagnosis and you were going to
Hmm.
have chemotherapy,
Yeah.
that egg freezing was offered in that scenario. So it's sort of moved to being very specific for certain types of treatment to now being offered to anybody who wants to freeze their eggs can now go and do it.
Yeah, it is a way at the moment. It is a way that you can plan for having a future family plans and I really think that it is a kind of power and freedom that we have,
Yeah.
because it is all about having options and flexibility, basically.
And so, can you tell us what the process is? Like, if I was going to a fertility clinic, let's say if I was 20 years younger, and I wanted to freeze my eggs, what would be the process that I would go through? How would I start, for example? Like, how do I even begin?
So you need to have a couple of tests done. So AMH, it will be done. That is the anti-Mullerian hormone. That it'll give you roughly idea about how is the number of follicles that you could have. Then also something that need to be done is a follicular antral count and a scan, and then as well some hormones. So there is just the initial test that they are getting done in the clinic. Then after that, with all results, you have an initial consultation when the doctor it will decide which kind of stimulation protocol it's the best for you, for your circumstances, and for the results. After that, there is another pre-assessment when more bloods are taken, and then like biology, full blood count, depends of your ethnic group as well. It can be done any other test like a sickle cells. And then after that, you're waiting for your period. Once you have your period, contacting the nurse, and the nurse it will arrange for you a baseline scan, and then they will tell you when to start the drugs, the stimulation drugs. And they will, during this time, during the stimulation, it will be a monitoring about how the follicles they are growing, and sometimes some blood as well. And then when there is the right time and the follicles are grown enough, then it will be the trigger injection that it will help with the maturity, with the final maturity of the eggs, and then you will be booked for a collection.
Yeah. Okay. And how many days on average would that take? So, from when you begin your period to when you have your eggs collected, roughly, I know it's different for every person because obviously it depends on how you respond to the drugs, but what's a rough time frame?
Um, it may be something about like 6 to 8 days or 9 days, or yeah, it depends of the patient.
So, once you've had the eggs collected, what happens then?
Once the eggs are collected, then the patient is going through a small procedure under sedation or anesthetic. And then we are collecting the doctor is doing the procedure in the theater. And then the embryologist is on the other side in the lab. We are checking all the follicular fluid that the doctor is giving us. And then we are looking for the eggs. After finding the eggs, we will, what we call is stripping, is assessing for the maturity of the eggs, and then only the eggs that are mature are the eggs that are suitable for freezing.
So that's where you come in. Like that would be your
Mm.
job. The consultant would hand you, not literally hand you, but in the lab would give you the eggs that have been collected, and you would be looking at which ones were mature enough. Is that your role or is that the consultant role?
It is our role in the lab to check the maturity. We find out that not always the number of eggs that are collected will be the number of eggs that are mature. This is the case.
And so the mature eggs then get frozen.
All the mature eggs get frozen.
Okay. And so how long can they stay frozen for? What's the lifespan of an egg in the freezer?
Well, the eggs, once they are frozen, they are paused. So they are paused in time, and they no longer age.
Yeah.
So basically, the age that you are when you are freezing the eggs, the age that these eggs will be when you decide to use them.
How and they can stay in the freezer forever or
Um, the law at the moment permit to store the eggs for 55 years.
wow.
So yeah, you can let them frozen there for 55 years, and there is not enough evidence yet saying that the storing eggs or the eggs that are stored are getting damaged during all the time that they are frozen.
Okay, yeah, because I guess 55 years is how many years have they been freezing eggs for?
We've been freezing eggs for many years. I would say about like 20, something like that.
Yeah.
I cannot tell you like when it was the first egg freeze done, but I remember my early days in embryology in 2006, and yeah, we were freezing eggs.
Wow. Okay.
Yeah.
So tell me, is there an ideal age at which we should be doing, like, can anybody at any age freeze their eggs? Like, what do you think is a good recommendation, or is it, whenever it feels right for you?
Well, the younger the better. Yeah, unfortunately, it is like this. Unfortunately, but just because if you are thinking of freezing your eggs or preserving your fertility, when we young, our ovaries, they are able to produce more follicles, and then those eggs in those follicles, they're more likely to be genetically healthy. So the younger the better, just to keep your chances higher. But obviously, we can freeze eggs when we are mid 30s, early 50s. The thing here is like to achieve the same goals of younger eggs or the same results as being younger, we need to freeze more eggs.
And so that leads me on to the next question of
Yeah.
how many eggs do you need, or what is a good number to think about that would give you? I know there is never 100% guarantee because this is fertility. There's never a full
Yeah.
guarantee. But
Never.
in terms of like the best place you could possibly be, how many eggs would you say in the freezer? Let's say if you were, let's say you were, because I imagine that lots of people around the age of 30 are looking at this.
Hmm.
So let's say around the age of 30, 35, around that age period, how many would you be wanting to put in the freezer?
Well, there is not a simple answer for this.
Your fault.
Yeah. But it really depends on several factors, and the main factor here is the age. So the age at the time of freezing, it will be the best way to predict how many eggs you will need to increase your chances to have a live birth later. But it is also depends of your family plans, because maybe you don't only want to have one baby, you want to have one, two, three, five. I don't know. So then you will need obviously more eggs, and of course it will depends, unfortunately, on how many cycles you can afford,
Yeah.
because this is about money, and financially it could be as well. As young we are, unfortunately, poorest we are. So yeah, financially it could be as well a struggle. But yeah, it depends mainly on your age to freeze and your family plans, and then. But of course, like there is no a magic number here to guarantee a pregnancy later. I'm afraid. Um, there is an study that it was done in 2017 that actually it estimate that woman under 35, um, by having 15 mature eggs in the freezer, we have a chance of 80% of, they will have a 80% a chance to have at least one baby.
Okay. Okay.
When women are between 35 and 37, to have a chance of 80%, not just now 85 as before, 80, for having a live birth, we will need about 20 eggs, mature eggs in the freezer. And then when we are like between 38 and 40, to to achieve the same goal, as I was saying before, we will need about 30 eggs.
Okay. And that is because the percentage of the number of eggs with chromosomal abnormalities is obviously going to increase as you get older. Therefore, you need a larger cohort
Yeah.
with which to work on when you're ready to fertilize those eggs to create embryos.
Yeah, sorry to
No,
interrupt you, but just only this is a guide.
yeah.
Okay, so there is no exact number, and as well, like different clinics, they might have like a different reference and everything, but and also we know that for achieving a pregnancy or a live birth, it is not only depends on just the egg, so there are other factors. So but of course we need the reference of the eggs, that is one of the important cells. Yeah.
Hello, I'm quickly interrupting this episode to let you know about our big fertility walk and talk between the 11th and the 19th of October. Over the week, we will be hosting a series of walks and talks and online webinars to provide information, connection, and empowerment for wherever you are on your fertility journey. If you'd like to join us in person for a walk or online for a webinar, all the details to sign up are at the end of the show. So, on average, I mean, I know this is a bit of a difficult question, so I'm sorry, but on average, when you see people going through clinic at the Lister, what numbers do people get per round of egg freezing? So if you've got a person in clinic doing egg freezing, what's the average number, roughly speaking, that you see people collect with each round? Or does it wildly differ?
Do you mean like how many cycles patients for egg freezes are coming through?
Yeah, how many eggs do people collect with one cycle on
Oh,
average?
well, this it depends because we have a patient different age. They are coming. They are many patients that they are coming because they have found as well that their AMH is low. Even though they are young and their AMH it is low, then they want to keep their fertility now, so then they come in for several rounds. But unfortunately, the quantity of eggs, it is not a large number, and then we may collect like 2 eggs, 3 eggs,
Yeah,
4 eggs. You know what we wouldn't expect with patients under 30, but this is happening. Then we have patients that the number of eggs, it may like correlate with what we are expecting for their age. So depends of the stimulation how it works. An average of like 11 eggs or 9 eggs, something like that. And then the majority of patients, they need like more than one cycle to come through and then get the right number,
yeah.
uh, just to have some chances later to conceive in future, or to increase their chances to conceive in the future.
Yeah. So I guess some people they can probably do one round or two rounds, and other people might have to do three, four, five.
Yeah, yeah.
Yeah. And can I ask again? This is putting you on the spot, Marker. But do you see many people through clinic who freeze their eggs? They go off, live their life. They come back years later, and then they use them with success. Do you see lots of people returning to use their eggs, or do people freeze their eggs, then meet people, or they decide they're never going to use them? Like, I can't think what the question here is that I'm asking. What percentage of people come and use their eggs, first of all? Do you know?
Um, I I wouldn't, I couldn't give you a number for sure, but we see more and more often now people coming for throwing their eggs just because when they froze them, they didn't have a partner, or it was not the right moment for them, or also patients that they had like health problems, or like it was not the right time for them because they were not financially, or their job, or like different circumstances. And then yeah, it is true that we having like more and more patients that they are coming throwing their eggs, and maybe what they do is doing like a fresh cycle, and then throwing the eggs that they have, like younger eggs previously frozen, and then we grow them all together. We fertilize them all together. We grow them all together. And then the majority of the patients, then they decide to put back the embryo that it has been created with the younger eggs, just because it has a higher chance of being genetically healthy.
Yeah. And I guess then at that point you could then freeze any embryos that you have. So if in that situation,
Yeah.
if you'd have created 6 embryos, you can have one transfer and then you can freeze the others. So
Yeah.
you can unfreeze an egg, fertilize it, create an embryo, and then freeze it.
Yeah.
Um,
Exactly.
yeah, crazy.
Unbelievable.
Yeah, it really is. So you see people have success then using their eggs from
Yes.
that they've previously. Yeah, amazing.
Yes. Yes. Of course.
And so how can you so if anyone's listening to this and they're thinking they're interested in freezing their eggs, what advice would you give, maybe as an embryologist, but as an acupuncturist, as a holistic practitioner, how can you prepare? Because there is no test, is there, for egg quality? What can you do? Do you think you just need to crack on and start a cycle, or do you think there's some things that you can do beforehand to optimize it?
Well, I think people now and patients, they are more conscious about like preparing for their body before going through IVF in general, and they do everything they can. So we know that the importance of the 3 months before the ovulation. It takes at least 3 months to get to the stage of primordial follicle to the preovulatory follicle. So during these 3 months, this time and the development depends on the right amount of hormones and nutrients that they reach the ovary. So then to have the right hormone balance at that time during these 3 months, it is crucial and very important. So then how can we improve this hormone balance and then bring all the nutrients and all the good things and hormones to the ovary to help these follicles to grow? It's basically maintaining a good lifestyle, getting enough sleep, managing stress, exercising, eating good fats, eating fiber, having acupuncture. So, yeah, a lot of things that are basically maintaining healthy habits and lifestyle.
I think you're going to be spending a lot of money on this
I know.
procedure. So, what would you know the average cost of a cycle?
I think it is the IVF. Well, no, sorry, the egg freezing cycle. It is something about 5 to 6 thousand,
Okay, yeah, yeah,
something like that. But it depends as well on like medication if you need like an extra points.
yeah.
But yeah, it is a lot of money.
So you're going to be spending a lot of money on it. So preparing your body, making sure that your vitamin D is good. All the basics. I think a worthwhile thing to do and get ready for.
Definitely, definitely, because it is a lot of money spent, and better that um you feel as well like you have done all you could just to maximize your chances.
Yeah.
Um,
And I have read that in some ways, and I know it's not always easy to do because it really does depend on each person, but that embryos are better in that they are more robust so they can survive the freezing, defrosting process than eggs, which there is a higher chance of damage when they're being defrosted because they're not as robust.
yes, in a way, yes, it is. It is like that. So there is better survival rate with embryos than with eggs. Basically, not only because they may be more robust, but this is because they have hundreds of cells.
Yeah,
An embryo, a blastocyst, it has more than 150 cells when the egg is just one cell.
yeah.
The problem here is like if there is any damage in one cell that it is the egg is gone. If there is any damage in one cell, two cells, 10 cells, 20 cells of a blastocyst with more than 150 cells, still the embryo is surviving because it has more cells to actually recover and it will keep it like replicating. But if the egg that is only one cell, it is gone, it's gone forever.
Yeah, I've worked with somebody in clinic who's done a combination. So they have frozen eggs
Mm.
and they have frozen embryos. So they've used a donor as like a full insurance policy and created some embryos to put back in the freezer and created eggs to put back in the freezer, which I thought was an interesting way to cover all bases.
Yeah. And by freezing eggs, you have more flexibility in future to choose your partner.
Yeah.
Okay. So you can use donor sperm, you can use your partner sperm. That is why we are freezing eggs. Otherwise, when you have your partner, and I think the option of freezing embryos to fertilize eggs and freezing embryos is the safest one, and also as well the one that it will give you answers,
Yeah.
because by fertilized eggs and then growing them into embryos, we will have answers if those embryos develop into a blastocyst or not. And then we can freeze blastocysts. But what happens if we don't have blastocysts and we end up with no embryos? Um, if in this case we just only froze those eggs, we are going to keep them in storage without knowing the chances of those eggs, just thinking that we are preserving our fertility. But basically it could be that those eggs, they were not like good enough to create embryos.
Mm. And you don't
Um,
know that until you've
exactly.
yeah, yeah,
So that's why as well, like freezing eggs, it is a way to preserve your fertility, but it doesn't guarantee you like a pregnancy later on,
yeah,
or a baby later on, because as well, we don't know about the genetics inside. We don't know how it's gonna fertilize. We don't know how it will develop into those embryos, and if they will make embryos enough to be a blastocyst,
yeah.
or which quality. So yeah, when we having, I think that by having a partner or a some sperm that it is ready to use with these eggs, I think freezing embryos it will be the best option.
And can I ask what if, so say for example, if someone has their eggs frozen at the Lister, do you say to them, okay, we'll store them for 5 years and we'll get in contact with you every 5 years to check whether you still want us to store them? Like, how does it, because I presume you have to pay for the storage to keep them there.
Yes, you have to pay for the storage. You pay year by year.
Okay.
So basically, patients what they do is they sign a consent, and this is they usually they consent for 10 years of storage, because they may have like a short-term plans.
Yeah.
And then the first year it is free of charge. It is on the cost of the freezing, and then patients are getting contact the second year of the storage if they haven't used them. And then every year they will be contact just saying, we have your eggs here. Are you happy to keep them? There is this fee.
Okay, well, Marca, I think we have covered pretty much everything. Is there anything else that you want to add before we go?
I don't think so. I think
No,
we had
we smashed it.
yeah.
So, Marca, you will find in working as an acupuncturist in central London. And also, actually, we are doing a Q&A with you, aren't we, Marca? I've just remembered.
Yeah.
So, Marca is going to be doing a Q&A in our community. So if you have any questions that you'd like to ask about egg freezing, about embryos, about work in the lab, I'll put all the details on. You're free to ask questions and come and join us for that. For acupuncture, she is in central London every Tuesday. And if she's not there, you'll either find her at home relaxing, or she will be in the lab at the Lister creating embryos. So I'll put all of Marca's details and the Lister's details on this podcast as well. So Marca, thank you very much. You came back after the first podcast experience. You came back and you did it again.
Oh my God, I cannot believe it. Ready for the Q&A.
Yeah, the Q&A. So thank you as always for your time. It's been lovely to speak to you.
Yeah, thank you. Thanks so much, Hannah. Bye.
We hope you have found this helpful. If you'd like more on fertility education, please see our Teaching to Conceive free course linked at the end of the show. You'll also find the link to join our community. For more personalised fertility support, you can work with us one-to-one in clinic and online. You can book a discovery call to find out more.